I definitely ran too early postpartum and then ran too hard, too fast for sure. And peed my pants. Everything.
Did you realize that was not okay at this point?
Yeah. I mean, and it was like, I think in the past it was like little dribbles. Like this was like, I would fully empty my bladder running. And I was like, I can't, like I had to stop because I would like pee on my treadmill or like on the ground. All right. Jumping into drip and dry. And we always do drip and dry. Drip for like your highs of the week. We say drip because we're pelvic floor PTs.
Love it.
Kind of going with the pelvis theme. Mm-hmm. Vaginal theme. So what's making you wet or drip?
Love it. Love that. Let's see. I got a couple things. I got a couple things for everything because I make every short story long.
Same.
My drip would be spending time outside when it was like 70 something degrees on Friday and Saturday. And just sent in my SIBO breath test today.
Amazing.
So
amazing.
It's been a long time coming, as you know. So excited to get those results.
Yeah. And we're going to hear more about your story with that later, but that is so exciting.
Yeah.
When do you get the results?
I think a week, like 5 to 7 days. So hopefully by next Monday,
oh my gosh.
I'll know. Or we'll see.
Exciting. Okay.
See what goes next.
What's making you dry?
What's making me dry?
It's your low.
The rain.
The rain's making you dry. I love it. That's hilarious.
And I would also say my daughter has had an ear infection for the last 6 weeks.
Oh my gosh. Just like constant or like?
They think it's one that just keeps coming back. And so she already took 2 sets of oral antibiotics and then had to get Rosef. I think it's Rosef.
Oh yeah.
Shots. Oh. And she's still just like so uncomfortable at night, like laying down with the pressure. So sick kiddo is rough for everybody involved.
Dang it. Yeah.
How about you? What makes you drip?
The drip would be, oh my gosh, what did I just say? That I'm in my follicular phase. So I feel really productive right now.
I love that for you.
I feel like that's always like, especially with my like neurospiciness, ADHD, I feel like I really feel that between luteal and follicular phases. Like I feel very productive, which is exciting.
That is exciting.
Yeah.
Can't wait to see what you accomplish today.
Run with it. Yeah, I know. And what's making me dry is also kid sickness. My daughter's in kindergarten. Lydia's in kindergarten. And so I feel like she is getting the kindergarten cold that's been going around. And so it's
that time of year.
It is.
And this crazy weather up and down, I feel like is causing everybody to be sick or joints ache for the older population.
Yeah, the pressure is like really making everything kind of flare up. So anyway, okay, well, going right into it, today we're going to be talking about like why we chose pelvic health, because I feel like is that the question you get all the time? I feel like whenever I'm doing, especially if I'm doing a rectal exam on someone.
Why do you want to do this?
If it gets quiet, people are like, so how'd you choose this career path?
Yeah. Or they're like, I feel bad for you. I'm like, no, I chose to do this.
I know. And I'm really passionate about it.
Yeah. So don't feel bad.
Yeah.
I actually feel like I don't get that question very often, but I want it because I love sharing.
I love that. You're probably just like educating all of the time. So
maybe.
Yeah.
That's my favorite thing to do.
Okay. So we're going to start with you because I am a personal part of your story. So
yes, you are.
I have only convinced everyone to work here. So,
yeah,
you're one of them.
It's funny because I don't know if you knew, but in the back of my head, I was like, I'm going to go to Bethany because like maybe I can learn from her and then maybe someday work for her.
Oh, well.
So it was like in the back of my mind the whole time too, which is,
that's great.
I don't know if I've ever told you that.
I don't think you have. That's really good to know because I was definitely like, she's not going to want to work for me.
Oh, girl.
Why would she?
Little did you know.
Well, it was a great decision on both of our parts. So.
Oh, I agree.
Yeah. Okay. So tell us
why'd you choose pelvic health? Okay, so many reasons. Well, in grad school, I loved pelvic health because I loved, and sometimes this sounds weird, but the like intimacy of it, like the one-on-one, the time you have with your clients, that you can be that vulnerable, that person that they can be vulnerable with and share those things that they don't feel comfortable sharing. And just be that person for them to trust in. Yeah. And so that's what brought me like towards like leaning towards pelvic health in general. But then once I had my own experience is kind of what sealed the deal. I have had constipation since 2015. So about 11 years. And also, well, I guess constipation in general, bloating, was looking it up and I was like, oh, I should go to a pelvic floor PT. Found Bethany, knew each other when I was an undergrad. Yeah. But, decided to you convinced me to not go to insurance-based clinic, which forever thankful for that. A lot of reasons, but, went to see Bethany, found out there were so many other things that I just didn't know and was doing wrong, like pushing my pee out, squatting over the toilet, straining to have a bowel movement. I didn't know that intercourse was not supposed to be painful. And I learned that at my first pelvic floor appointment. Yeah. So I just learned a lot of things and that I had a lot more issues than I thought I did.
Well, yeah, it happens.
But, learned that pelvic health can help with constipation, no longer have painful intercourse. And then in the midst of everything, learning that it can also help with fertility, which down the road started to struggle a little bit with that. I just realized that even in my first appointment, just you educating me on so many things, I feel like I got like 50% better just from learning, not even from hands-on, if we all just talked about these intimate subjects, so many people would feel better.
Yeah, totally.
But it's just people don't like to talk about it because they feel awkward or embarrassed. Yeah. And I just want it to be open conversation.
Yeah. One, we don't know what's normal because of that. Right. So, I mean, it even goes back to potty training. Which makes sense when you're potty training 2 and 3 year olds to have them go pee every time you leave the house. But as an adult, we just keep doing that. And that creates a really bad habit. So,
well, and it's just pressure. Who knew? When you told me you're supposed to sit on the toilet and stool is just supposed to come out, I was mind blown.
Right.
I mean, you look at babies. I have a baby right now, and when she has a bowel movement, she turns all red. She's pushing it out, and I'm like, we're not supposed to do that now.
Well, but that's before that sphincter develops, though. Right. So we see that in a baby, but that's why we don't potty train babies, because they have to they're still figuring out that relationship, And so, but yeah.
Then it's how did I know I wasn't supposed to do that the rest of my life unless someone told me? And the PCP doesn't tell you those things.
No. And you're not learning it in sex ed or health class.
Right.
You're yeah.
The only thing you learn in sex ed is how to put a tampon in.
In a condom. So, yeah. Oh, that's crazy. And then your fertility story, I feel is a big piece of why you do Mercier therapy, which is really cool. Yeah. Yeah. And you've helped so many women and yourself.
And myself. Yeah.
So, yeah. So tell us just a little bit about what that is and how you found it. Cause I honestly, you approached me about it when you were already working at WellCore, taking a course, but how did you, through Lizzie, I think maybe, how'd you find it?
You found it.
Oh,
she was probably on her luteal phase. Oh,
that is, if that's not the story of my brain.
It's okay. It's okay. Okay. My brain I'm losing my brain cells right now. So I get it.
I've never had them. So,
so with the constipation and as I said earlier, I'm testing for SIBO. I've just had a lot of gut issues when I was in 2015, the reason it all started was because I had torn a bunch of ligaments in my ankles, and I ended up having to have multiple surgeries. I was on narcotics. I was on iron because I was anemic. And then I had to have a PICC line because it got infected. So I was on antibiotics. And so it really messed with my gut.
Yeah.
And so, like gut inflammation can affect a lot of different things, including fertility, which who knows? Nobody knows what that magical thing is when you get pregnant. It's just a bunch of puzzle pieces that are put together to make that puzzle. But, so I dealt with that, and that's kind of what made my gut not right, which started the constipation. And so then fast forward to when we started trying to grow our family, my period wasn't regular. I had been on birth control for 14 years because when you're 14 and you have an ovarian cyst, they just tell your mom to give you birth control and you won't have painful periods anymore. Right. And so I was on it for so long.
Yeah.
So my body really didn't know what to do. And also my gut was still kind of messed up. You showed me things that helped with my constipation, anxiety, things like that to help with bowel movements, but still things weren't right. And it had been a year. And so, the OB, sends you to the reproductive endocrinologist who does tests. And I wasn't ovulating. So I was put on medications. I mean, fast forward through an IUI, a couple, timed triggered cycles, and HSG, all of the tests, and they couldn't figure out why. And obviously it takes two to tango, but my partner, he, was fine. And so it was really just me who was the problem, right? It's me. Sorry, I'm the problem. And they wanted me to jump to IVF, and I was just concerned because if we don't know what the problem is, how do we know that IVF is going to be successful? Right. I mean, it's a lot of money.
Well, and you were still having these like gut issues.
Yeah.
And
still not resolved.
We felt, I mean, I remember like talking to you about it, and I'm saying we, I felt like
you were a part of my journey.
Listened to very well with like any.
For sure.
Yeah. Everyone felt separate. And so is that when we kind of found like visceral?
Yeah. So it felt like a protocol. I was a number in a protocol, not treated as an individual. Yeah. And I was like, just none of this feels right. Like, I feel like my body can do this. I just feel like we're missing something. Like there's got to be a reason.
Yeah.
And that's when you came to me and you said, hey, I want to support you through this journey of trying to grow your family. There's this thing called Mercier therapy, and I want you to be certified in it because I think not only can it help you help others, but it can help you.
Yeah.
And I was like, oh my gosh, this is exactly something I've been looking for, something conservative, something that makes sense.
Yeah.
And something like I would love to help other people through this journey. Because we all have different journeys.
Yeah.
In pelvic health or fertility, but when you somewhat understand what someone else is going through, even though it's different, it's so much easier to go to a provider that knows a little bit of how you feel and can empathize a bit. Yeah. And so I really loved having that opportunity.
Oh, and then it worked for you because you got pregnant. You took the course and then took the course in May, got pregnant at the end of July. Or the middle of July, which is pretty wild. But I just think too, throughout that whole journey doing the Mercier, and I was trying to educate myself as much as I can because in this day and age, you have to advocate for yourself. I feel like you just don't have that much time with providers, and you got to go in knowing what you want to know, knowing what questions you want to ask. And so I really educated myself and felt really hopeful that I was kind of figuring out what was wrong with my body and my cycle. And right when I felt hopeful, I got pregnant, which is really crazy. They say a lot about mindset when you try to get pregnant. And I just really think that that's so true. Like just
listen to your gut, and it's hard to be positive, but once you do feel good about something, follow your gut because your gut's usually right.
Yeah.
So, yeah.
Cool. Yeah, well,
so many different pelvic floor things in my life.
Oh,
it's an ongoing.
Same. I feel like I'm like shocked that I didn't like find this career path sooner, but because I struggled with pelvic floor stuff. I mean, I remember going back to like high school, always struggled with constipation.
I don't think I knew that about you.
Yeah. I mean, it's like less, I mean, I think it goes back to like, I've always had, now I'm like really going deep, but I've always had acne, and I was on antibiotics a ton as a baby and had like, it was so bad that I ended up with like a stomach ulcer. And so I think my gut has started
from there,
messed up for a long time.
Yeah.
But I think my mom just always said like, oh, our family, we just have small bladders and we're just constipated. You're just like me. I only poop every 3 days or whatever. So I just grew up thinking it was like normal, in that you just, when you turn on the water, you cross your legs because you have to pee, and that's normal. So, I mean, my mom had 4 kids vaginally. Yeah. So I'm like, I mean, I guess I was a C-section, but then she had 3 kids vaginally. And so I think that was part of it, but she also just kind of, those were the things that I remember hearing, and she didn't know any better. But anyway, so I just kind of thought it was normal, ran cross country, and it was like cool. Like if you peed your pants at the end because you like pushed yourself so hard that you like lost control of your bladder. Yeah. And so, which is like maybe not normal for every cross country runner, but our team, we thought it was funny or something. I don't know. So I just never thought, I just never thought it was abnormal.
Right. Because nobody really talked about or educated you on it.
And then had pain with sex when I got married, and someone told me like, oh, it takes like 8 times to have like having sex before it doesn't hurt anymore. And I remember being like, okay, I just have to get to 8.
Oh my gosh.
It's just like hilarious, the things that you hear. And I remember talking to my OB about it, and it was like the classic, like, just relax, have a glass of wine, that kind of stuff. And I just kind of like wrote it off. And then we did get pregnant. And I was working at a brain injury hospital, and during pregnancy, I was like, this is like way harder than people are making it seem, pregnancy. I like had no clue how people were just like walking around going to work every day pregnant. I'm still in shock. I'm like, people just like work 8 hours and like, it's no big deal with a baby growing inside them. And so I started looking at pelvic health courses online, just like with our, like what I could take online
for CEUs.
Yeah. And then it was a lot of like the diaphragmatic breathing and stuff like that. And I started realizing like, oh, I've had pelvic health issues forever. And then I started applying the breathing stuff with my brain injury patients and like nursing home patients, like telling them to like breathe as they turned a corner or like exhale as they stood up. And I was noticing that it was like not only helping them with like their core and their balance and that kind of stuff, but it also was like helping them prevent some incontinence too and things like that, which was just really cool. So then I was like, this is awesome. But at the time I like had no idea how I was going to switch from brain injury to pelvic health. And then Lydia was born November of 2019. And so I was supposed to go back to work like March of 2020. Went back to work like one day. And they, the like hospital or the brain injury hospital was like, we're going to just accept all of the patients who have COVID. And like, if you guys have to like stay here and sleep here, we'll just do that. And I was like, I don't know.
And you had a baby at home.
Had a scheduled C-section with her, cause she was breech, and she ended up being like sick and in the NICU and had, ended up getting diagnosed with a genetic disorder. And so I was just like, had so much postpartum anxiety.
Oh, I bet.
And then B was like, there's absolutely no way she can get sick or get COVID. And then, so I just like walked out of that job, which is not my personality, but I was like, I'm not coming back here.
Yeah.
And, then I was on unemployment for a long time. And I went actually insane, I think. Yeah, but on the plus side, I was able to be on unemployment and stay home with Lydia, which was like, looking back, was huge.
Well, and then a lot came out of it.
Yeah, well, Core was born. Yes. So yeah, then I kind of like, running was like one of the things that I felt like was helping me mentally. And so I definitely ran too early postpartum and then ran too hard, too fast for sure. And peed my pants every time. Did
you realize that was not okay at this point?
Yeah. I mean, and it was like, I think in the past it was like little dribbles. Like this was like, I would fully empty my bladder running. And I was like, I can't, like I had to stop because I would like pee on my treadmill or like on the ground.
Yeah.
So I think it was like not okay.
Yeah.
And then I was just really frustrated, sad. I was still, I mean, I obviously knew then too, because I had taken some pelvic health stuff that like it wasn't normal.
Right.
So I that's when I was like, I'm going to Google and like look on Pinterest for like a post C-section, like return to running. Like someone has to have some sort of like program online. There was like nothing. I couldn't find anything. Now you can find a lot of different things, but at the time there was literally nothing. And I ended up using like an ACL return to running, program and like modifying it for myself and just was like, I'm just going to practice like doing pelvic health on myself and see if this even works. And it did. So
amazing.
I also had like a big recurrence of pain with sex after my C-section. So kind of did like running and then pain with sex, did my own like dilator training and program. And that sucked, but it worked.
Yeah.
And so that's when I was like, okay, this is like, I really want to do this. And I went back to work at Olathe Health, doing pelvic health, through insurance because I just never even thought about starting my own business. And covered.
It takes a lot of gut to do that.
Well, yeah. And I was still kind of like new at it. And I just wasn't sure if it was like the right thing to do. Anyway, but then I went to the insurance-based practice and I realized that no one knows what they're doing. There was no mentorship. I was the only pelvic floor. I mean, there was other pelvic floor PTs at Olathe Health, but not that I like directly worked with. Right. So I was by myself in a room for 8 hours, seeing patients every 30 minutes, super complex people, and then insurance
30 minutes, not enough time for that.
Yeah. They might have given me 45 minutes for some. Anyway, it was not enough time to like educate someone, especially someone who had never, like their doctor just like told them to go.
Yeah.
And, they were having like severe prolapse, things like that. Yeah. So it was just, I hated every second of it. And I didn't know what I was doing. And I was like, I think I'd be better off paying a mentor and like doing this on my own. And so that's what I did. So I just found someone in like Pennsylvania and was like, can I pay you to like talk to me about patients? And then I started seeing patients out of my friend's office who was a mental health therapist. And then Maureen Francois.
Oh my gosh. Yeah. I also never knew that's how you pronounce your last name.
Oh yeah. It's kind of like LeBlanc. So that's kind of how the baby was born.
Amazing.
And
how did you find this girl in Pennsylvania?
It was like through a Facebook group.
Yeah.
And she just owned her own business. And then I saw her like commenting on a lot of like the posts.
Yeah. She had a lot of knowledge.
Yeah. And I was like, I liked her answers and how she like responded to things. And so
that's awesome.
She gave me a lot of confidence too, because I would call her and be like, I don't know what to do with this person. And she was like, you do.
Yeah, you're like, this is what I was thinking. Yeah. And they're like, that's exactly what's
yes. Yeah. So that was great. But yeah. And then I just convinced the best PTs I knew to join me. And that's
so sweet.
And the best administrators.
Oh yeah.
Help as well. I know. We're gonna have to hear Blair's story too sometime. I feel like we're
maybe someday. I just think, well, number one, you're great. And two, you've helped me so much. But I also was like, she just went from inpatient neuro rehab to pelvic floor. So maybe I can too.
Yeah. I think it overlaps way more than people think. And I actually think we're at we're really good holistic therapists. And I think that coming from like an insurance orthopedic standpoint, you get really used to looking at individual body parts.
Joints, yeah.
And I think that in pelvic health, I think in all cases, you need to look at the whole person,
Absolutely.
but definitely in pelvic health, there's, I mean, you have to look at everything.
I mean, just think back to both of our stories, like gut, habit,
right,
mental health.
Yep.
Just
totally.
So much involved.
Yeah.
Like every system is involved. It's all connected. And it's just, you just really got to find providers that will look at you as a whole and treat you as a whole and an individual.
Yeah.
Which is what I love about this place, WellCore. It's because we get that time that we can go through all of that with our patients and really take the time to let them feel listened to, advocated for, and taken care of.
Yeah, for sure. Okay. So now we get to do just the tip. After that, like lovely trauma-informed, ending, then we're like, just the tip, which is a tip from your neighborhood pelvic floor PT.
Just the tip. Gosh, can I have multiple tips? Okay.
And you have like the best jokes out of nowhere.
Oh,
always.
wow.
It's so good.
Thank you so much.
It's so good.
I really appreciate that. Another reason why I work here. What? Okay. Okay. Well, biggest tip, get a squatty potty for constipation.
Gosh,
I mean, that changed my life. Raising your knees above your hips doesn't have to be a squatty potty, but a stool or whatever, can really help open up that rectum to help stool come out if you do have constipation.
Totally.
And my other tip, because I like more than one tip.
Does Adam know?
No. He knows I like tips. I'm full of just so much really good information.
I love it.
I just can't stop talking. He knows that because he doesn't like to talk. So, it's just a one-sided conversation all the time. And my other tip would be trust your gut. Like when it comes to your health, whether it's fertility, whether it's incontinence, whether it's constipation, pain with sex, like if you feel comfortable with a provider and you like their plan, roll with it. If you don't, seek elsewhere because there is somebody that will want to get to the bottom of it and help you, and just listen to your gut because so many times I didn't and my gut was always right.
Yeah. I love that. Okay.
Do you just like one tip?
I feel like because you had two, I have zero. No.
You're welcome.
No, I'm going to steal from Meg and say your rectum is not a storage unit, to keep on the theme with bowels. So like if you need to poop, go poop. Like don't hold it. Because that was another big thing is like, I just didn't feel comfortable pooping in public for a long time. And you're right. You have like 2 minutes to let your poop out before it like gets sucked back up and reabsorbed.
Terrifying. I would love to have an episode just on that.
We will. Yeah. I feel like we have a lot. So
I can learn more from all of you.
I know, right? I feel the same way. So, okay. So that's our podcast. Everyone unclench your butt cheeks, unclench your jaw.
Take a deep breath through your diaphragm, and we'll see you next week.